Everyone, we're so sorry about the delay. We had a conflicting meeting and technical issues, but we are so happy to be here at this special edition of Nursing Grand Rounds. And all Nursing Grand Rounds are special, right? If they weren't important topics, we wouldn't be hosting them at Nursing Grand Rounds. But why is this Grand Round special to me, at least? It's special for different reasons. It's special because it supports the hospital and the health system's efforts for diversity and inclusion. It's also special because it supports Nine Monty and the Gender Affirming Surgical Program. And most importantly, it's special because we're celebrating this very special month. Do any of us know Rainbows Give It Away? What's this month? Pride Month. Nothing better than that, yes. So without further delays, I'd like to introduce our three presenters. We have Andrew Wong. It's a long title, so I'm going to have to turn around and read this, so maybe I can read it from here. Senior Director of Patient Care Services, Clinical Professional Development and Nursing Education, Magnet Research and Wound Endoscopy Services. You are very busy. You must be very tired as well.
I like to say whatever Irene needs.
And whatever Irene needs. And then we have two of my very own clinical Ladder 3 and certified nurses, Karen Goldfarb and Annalise, or also known as Annie Rohrecker. So thank you very much and enjoy Nursing Grand Rounds.
Thank you, Denise, for that wonderful introduction. Hi, everybody. How's it going? Okay, that was better than I thought it was going to be. You probably just got that pizza in you. You got those carbs running. So, like she said, welcome to our edition of Nursing Grand Rounds. The presentation today is going to be caring for gender diverse populations. So it's Pride Month. It only makes sense that we kind of infuse this education. We're excited to bring it to you today. So some learning objectives that we have for you today, and we'll do our best in the time that we have to get through these as best as possible. Understanding the importance of healthcare equity, which Andrew is going to go through with us in a little bit, defining terms related to gender identity and expression, which are very important, and they're actually two very separate things. Verbalize understanding of the importance of, as well, preferred names and pronouns and their usage and how they interact with us as healthcare workers and what we need to be aware of. Understanding, oops, it's on the timer here. It's keeping me honest. Understanding gender neutral language, clinical and cultural competence, how to create welcoming environments for our patients and our families, understanding and going through the gender affirming surgical program, which Karen will go through, and as well as resources for patients and families. So this is our outline. These are all the things that we're going to be going through today, and we're excited to bring it to you. So I'm going to turn this over to Andrew. He's going to be reviewing stigma, bias, and discrimination. So Andrew.
All right, good afternoon, everyone. So happy Pride Month, and I kind of wanted to go around the room. If a few of you guys can shout and just tell us, what does Pride mean to you? Expression. What do you mean by that? Awesome. I love that. How about anyone else in the back? One of the nurse externs. Acceptance. Great. What do you mean by acceptance? Awesome. Yeah. And so one of the things is that, when we talk about this, and it's really great that we celebrate this right now, and we're talking about Pride Month and making sure that, it's a really great time to reflect, to be able to kind of understand what does that mean, right? And whether you are in the LGBTQIA community or you're not, what does that mean, especially for what we do, right? We work in healthcare, and having that understanding is really important. So we're going to talk a little bit about stigma, bias, and discrimination. And so I'd like you guys all to reflect, what does diversity and inclusion mean to you? So what does diversity mean? Being different, okay. Celebrating differences, right? That we have variety, right? So that it's not just the same ideas that are happening, that everyone here is individual, everyone has individual thoughts, everyone has individual opinions, and understanding that. And then tying that back to what is inclusion, having that inclusion and understanding that we want to make sure that we celebrate everyone's differences and have that inclusion so that we truly are able to kind of elevate where we go. And I always like to tell this story because I always like to think a little bit about even my own journey into coming out. And when I think about it, I grew up, I used to tell people I grew up in firehouses, right? Because I did emergency medical services. And during that time is, I think, and that was like sometime in the 90s where things were starting to change a little bit. And I'll tell you, there was a lot of fear. And I had a lot of fear. And the reason why I had a lot of fear during that time was because I had fear that I wouldn't be known as the person who can deliver good care. It was because I was gay, right? Or it wasn't that I would just all of a sudden just be like, oh, you're gay, so this is what you do, et cetera, et cetera. And so understanding some of those things in healthcare is important. And we talk a lot about stigma, right? A mark of disgrace associated with a particular circumstance, quality, or person. And that really ties a lot closely to bias as well. And when we talk about unconscious bias, I love this image right over here, right? The idea that you can go ahead and think about somebody, whether you're a female, and think about, oh, well, could you do this or could you not do this? Or if you're a male, well, do you have this type of opinion or do you not have this type of opinion? And we do a lot of different things to kind of fight against unconscious bias. The most important thing is to understand that we can all have unconscious biases, right? Just as much as I can walk into a room and say, well, this person's going to judge me because I'm a larger person and think I can't run around a room in an emergency situation. Or I can go ahead and say, well, they might judge me because of this, et cetera, et cetera. So understanding those things are so important, especially when we think about this with our patient experiences, right? And I can tell you this because I was an ED nurse for a really long time. And what happens when you're in the ED as an ED nurse? Oh, it's the same old CHFer who's coming in. It's the same old COPDer who's coming in, or this person's coming in for this, and they're going to talk about this and complain about that. But understanding that everyone has a unique story and has their own opinions, and that might not be there. And I'll tell you about this in the patient experience. So I worked in New York City for most of my career, and during that time there, I saw a lot of this happening in all different types of patients, right? Whether it would happen to African-American patients, whether it happened to patients of the LGBTQIA community, whether it happened to elderly patients or younger patients. A lot of times there's stigma and there is unconscious bias, and that translates to care, whether you believe it or not. It really does, and that's something to think about. So understanding the concepts of equality, equity, and justice. Equality is that assumption. Everyone benefits from the same supports, right? We are all the same. We're not going to treat anyone else differently. Right? Versus equity, it's really understanding that everyone gets the support they need to get to them where they need. But what we really want to do is get to justice. Understanding that we have different things that, that we can do to make sure that everyone has equality and equity and really doesn't have any inequity. And that's really important for us to do in healthcare and drive that. And so why is this so important? We talk about Pride Month. Well, it's important because representation matters. And I think in this world right now is when we have that conversation, it's so important for people to identify with the people who are caring for them are the same people that they can identify with, right? And understanding those different types of things. It's also really important because there's a lot of different things like microaggressions happening, right? You're too pretty to be lesbian. Who's the man in the relationship? You hear that a lot in the community. I'm not being homophobic, you're just being too sensitive. I've heard that a lot in the firehouse growing up. All of those different types of things, and understanding that, you know, a lot of times people will say things like, oh, I don't mean this, but, you know, and that type of question. And the biggest thing about this is also understanding allyship, right? And speaking out against those different types of things, or maybe speaking up about those things. Those can be some of the most powerful things ever. One of the things that I started to do recently was work with a program called Live Out Loud, and it was a really great experience where we go to high schools and talk to their GSAs, or Gay Student Alliances, and these are students who are anywhere from the age of, I believe when I was there, it was from the age of 10 to 16, and having them understand things like pronouns. And one of the things, you know, they asked a lot of questions about me and wanting to understand healthcare, and then I went ahead and they were like, well, what questions do you have for the students? And one of the questions I asked them is, why are you here? Because when I was your age, I didn't have these things. Why are you here? And to hear things coming, and I told this story before, one of the students was 10 years old, and he had said, I'm not gay, I'm not in the LGBTQ community, but I want to make sure that the people around me understand that I accept them for who they are. And that was super powerful to me for a 10-year-old to understand that. And that's something that we really should strive for, to think about. How can we be more like that 10-year-old boy Prince? And so one of the things of why is this important is that there are a lot of anti-LGBTQ bills in the United States. And this is really, really powerful. We're going to talk a little bit about one subgroup, which is the trans community, and why it's so important for us to support the trans community, because there's a lot of different things. An example of this is not having the ability to access your own health care. Okay, we know that there is increased rates of suicide, there's increased risk of drug use or everything else like that, just because you're struggling with who you are and how you fit into this world. And there's a lot of different bans out there. You guys have probably heard about them all over the news. And to think about that, right? To think about how you might have to uproot your entire life to go ahead and move somewhere where you can get affirming care is really, really heartbreaking. And so this is just a quick video to talk a little bit about that.
Over the last year, we have seen an unprecedented amount of anti-transgender legislation introduced across the country. I know one of the big spaces that is really important for us to have affirming care is within healthcare, right? And so with a show of hands, like who has been able to find like an affirming doctor? Okay, I see that it's a little bit complicated. Let's dive into that.
To find even like an endocrinologist is really hard. It's like somebody else is telling me who I am and why I still can't be myself. Oh, you need to wait a little bit longer because you don't know who you are yet. That was like a cannonball through my chest, because I was like, I've been feeling this way since I can remember,
And also finding things like reproductive health care. For example, I recently pregnant and I called 1,001 different doctors and I was like, can I take this with testosterone? And they're like, you can't actually get pregnant. You're a man. I'm like, look. I know what my anatomy is and whatnot. So yeah, space matters.
It's absurd at some point because some of these people haven't met like a trans person in their life.
Wow, okay, we're going there.
For, normal checkups and stuff, I still have to go to a normal doctor. It's kind of, I don't know, it's a little uncomfortable. Just feels weird. But I go to a doctor. It's for like all LGBTQIA plus healthcare and just feels safer.
When I have affirming and supportive healthcare, I'm able to thrive. I'm able to be me and just be happier. And I think that's one of the most important parts about getting healthcare, because it's for me, not you. Why would you care about it?
It is often like cis adults talking about trans youth and healthcare. I mean, what does it feel like to kind of have people who are not you constantly talking about your experience for you?
Yeah, I mean, how can you possibly think about making laws around transness without interacting with the concepts in real life? I mean, it's extremely frustrating, especially when it comes to healthcare.
It's frustrating too when you have a really good solution to a problem and you can't tell them because you're not going to be offered a seat at that table.
It makes this real. It puts something in front of your eyes for you to see it. You're seeing someone living their life as a trans person. And that's something that I've noticed with a lot of people is like, once they hear my story, then they think about it in a different light and in a different way.
Yeah, it's infuriating because it leads directly towards violence.
Yeah. It's aggravating how many people talk about us who haven't experienced what it's like.
A lot of times when adults are having these conversations without us in the room, they miss all the nuance that makes our experiences so beautiful.
So important about this, right? So understanding, creating safe spaces, and it could be something as simple as having a pride flag somewhere. right? I always like to talk about this whenever I travel with my friends. When they see a pride flag, it means something to them. It means that there is people around who understand the lived experience, or whether it's something of asking someone what their pronouns are, or having pronoun badge reels that show that, hey, there is an understanding here, right? Because a lot of people who live growing up in these marginalized communities and then come to seek care already have so many different worries, and then on top of that, worried about what's going on with their health and thinking about those different types of things. And remembering that healthcare is really important because it's human healthcare, right? And it's up to us to really be informed and advocate for our patients. Because you know what? One of the things, especially when you think about a lot of the different bills and the laws that are enacted, it's not going to stop people from getting what they need, right? But they're going to go ahead and self-medicate, and that's dangerous, right? Or they might not even medicate, and they might even have worsening effects of suicidal ideations and et cetera. So it's really important to think about that. One of the really great things about working at Northwell Health is we do have a lot of different resources, and these resources are here. We will drop this into the chat. We have things like the Expressionsburg, the LGBTQIA task force. The Expressionburgs have been working so closely with a lot of different partnerships like Trans NY, doing things and reviewing all of those different types of programs, and we have all of them available. One of the things that we are going to be pushing out is we are going to be pushing out an iLearn that's going to be talking about how do we go ahead and care for gender diverse populations. Again, really getting the information, getting the knowledge, building the community to really make sure that it's a safe space, that here at North Shore we deliver the highest level of care, and we deliver the highest level of care to everyone, no matter who you are, who you love, right, and things like that. So I'll pass that up.
Thank you so much, Andrew. That video, every time I see it, always just kind of like, it's something to think about. Just that, like, you know, I think we go through our lives, and if this isn't a lived experience of your own, it's interesting to see, you know, what other people go through. Now that he's given this beautiful overview of everything, we're going to kind of delve into a little bit more of the details of cultural sensitivity, and what that means for us and how we can use it. So just to quickly review, because I know that Andrew went over a lot of these things, a lot of people in the LGBTQIA+ community, they experience significant challenges that other populations might not. You know, experiencing elevated levels of physical and social and emotional abuse, you know, different risks that they're at. They face a lot of challenges with stigma, discrimination, and so it's important for us to be aware of what they're experiencing, what this community is experiencing. But as we go along in the presentation, we're going to start to focus a little bit more on the T in that acronym, which stands for transgender, which is commonly being used, or the term is kind of shifting more to gender diverse, and thinking of, you know, gender as more of a spectrum and not just something that's binary, like one or the other. So how many people are gender diverse, right? It's a great question. It's one that's really hard to pinpoint sometimes. Living in the United States, we don't have, you know, even as advanced as we are as a country, you know, we don't always have population-based information that's able to accurately show us what kinds of people that are living here and what are their needs, right? Especially if these things aren't researched and studied and looked at closer, right? So there are some population-based studies. The Williams Institute out of UCLA is a great place to kind of find a lot of this information. So this is updated information that they have on their website. And I just kind of want to point to how, you know, you have on the left-hand side of the screen, US adults and youth, and on the right side is New York specific. So on the left, it shows that 0.5% of the US population would define themselves as being transgender or gender diverse, which is about 1.3 million people. That's adults. So that's anybody over the age of 18. And right next to it, you'll see that youth, which is 13 to 17, it's only 4 years, right? 1.4% of the population identifies that way, right? So 300,000 people. And then you shift over to New York and you see those differences, right? And again, you're going to see differences by state because, again, as he just explained, different states have different laws, and you might find stronger biases in different places where they don't have legislation and affirming care and resources for these patient populations. So in New York, 0.53% of the population is considered transgender or gender diverse, which is pretty on par with the national average. But if you look over at the youth section, It's 3%. It's a huge difference. So I just kind of want to point that out, especially since we saw so many, younger people ages 13 to 17 in that video. They're going to be in that adult category in just a few years. So it's really important to think about that, because it's not just a pediatric thing, right? These are about to be our patients, and they already are our patients. So we have to be thinking about that.
We're going to think about how many of these communities where they're free to answer.
Correct. Just like he said, how free are you to answer that question? And this is the information that we have. Imagine all the people that maybe got to that or didn't answer that, or they don't feel comfortable, or maybe they don't yet know, right? So it's a lot bigger than what the numbers are actually showing. So discrimination and healthcare disparities in the gender diverse community. So Andrew went through a couple of these, but I really think it's important to look at less the right-hand side and more that left-hand side. 55% lost a job due to a bias, right? Harassed and bullied in school, 51%. A victim of physical assault, 61%. Victim of sexual assault, 64% of people who identify answered in that way, that they've experienced something like that. But I also want to direct your attention to the bottom one, because even though it's 33%, these are people who have delayed care or did not access any type of preventative care or health care due to discrimination by providers, right? This is happening in our own backyard. So this is why it's something that we even more so need to be aware of. So, like I said, some healthcare disparities, or some ways that they might experience a disparity or an experience that might turn them away from either seeking or continuing to seek healthcare. Outright denial of treatment, right? Like somebody said in the video, they went to go see an endocrinologist and they were told, no, you're not quite yet ready for hormones. You can't have this because X, Y, Z, right? Verbal harassment or insults. And this is not, it sounds so severe, like it's coming, directly in a mean or an agitated way. It might not be, right? Using incorrect terminology, not using someone's preferred name and pronouns. Those are things that can be seen as verbal harassment or insults, especially from people who are not coming from an understanding place or understanding mindset. Like I said, refusing to use pronouns and preferred name, inappropriate, restrooms or signage, right, to indicate where is it safe for you to go to the bathroom, right? We hear about this all the time in the news. So it's important to make sure we provide care for people, that we're also providing them the resources and the places to go to get the things that they need. Inappropriate questions and exams, right? Kind of mentioning to somebody like, oh, okay, well, so are you really a man or are you really a woman, right? Is that an appropriate question to ask when you're doing a physical and assessment of somebody? Absolutely not. And lack of culturally competent providers, like I mentioned, is something that's huge, right? And just to kind of give you a perspective, I did my master's program out of Stony Brook, and when I was doing it, I was doing a lot of research about how much is provided for, in nursing programs. How much, I don't remember going over any of this when I went through school, right? It was not even touched upon at all. And I was going through some studies and they were showing how, just the amount of that's even reviewed in nursing programs or curricula for anything LGBTQIA+ was about 2 hours in average. That went over like hundreds of baccalaureate programs. And when you break that down, 2 hours out of a 70+ credit program, it equated out to about 0.002% of the entire program, the entire nursing program that was devoted to all things LGBTQIA+. So you can only imagine that anything transgender or gender diverse was much, much smaller than that, right? And it's not just nursing schools, right? It's all types of healthcare professions, right? Physicians, respiratory therapists, radiology techs, like you see it everywhere, right? So it's important to think about that. So as we think about that, right, and we're saying, okay, we don't have these resources, we're not taught this, we're not exposed to this. If I don't have it in my personal life, how am I going to get the exposure? So it's acknowledging first, what are the educational needs? Where do I need to focus on? And not just me, right? But as a healthcare organization, where's the gap, right? We always do a gap analysis when we're looking at what do we need to figure out as far as what we need to provide people education-wise. So patient identification is a very important one, right? Proper patient identification, #1 national patient safety goal, right? Is like burned into our heads by now. We just went through Joint Commission, right? I'm sure all of you know. So as we talk about patient identification, we have to think about, okay, yes, I want to make sure I identify my patient correctly, but I also want to be sensitive to what they're saying their preferred name and pronoun is, and understand too that if someone is in transition or they're not, their preferred name might not be the name that's sitting on that white wristband, right? But we have a professional responsibility to make sure we are matching the name that's on their wristband, which is their legal name, insurance purposes, safety purposes, right? Their medical record number, their birthday, with what is actually listed for them, right? And then beyond that, we still want to infuse the cultural sensitivity to say, I want to refer to you as your preferred name, but I have to identify you by your legal name, and making sure that they know and understand the difference by educating them, so they're not getting upset or feeling like they're not being cared for in a culturally appropriate way, right? Using those proper names and pronouns when you're discussing things with them, using appropriate gender terminology, which we're going to review next. And also just remembering that, the patient is at the center of all of our care, and treating them as a whole human being is a huge part of that. And then Karen is going to go through with us a little bit later some of the surgical procedures and gender affirming care that we offer, which is not a step that everybody needs to take, but we'll go through some of the details of that. So I just want to point this out too. You can see behind me. So this is a piece from the Patient's Bill of Rights. And this is something that all of our patients receive. It's in that patient care book. I forget, I think it's on page 13 or something. Don't quote me. But it's on there, and it's something for our patients to be aware of what their rights are as a patient, right? What are they able to do? What do they have access to while they're a patient? And one of these things is, outlining for them, they have the right to receive treatment without discrimination. Race, color, sex, religion, their gender identity, their national origin, right? But to the right, we've also added, Northwell Health has added additional things. They have the right to receive treatment, not with a bias of their basis of gender, right? Room assignments, right, that align with their gender, right? And this can be a sticky situation, and we could talk a little bit about this later, but, if I'm identifying as a female and maybe I don't physically present that way in the norms of what people are used to, I still have a right to maybe being, roomed with a female. And that might have to be something that's evaluated. And we have private rooms in the building, but it doesn't necessarily mean that somebody automatically goes to a private room because they're transgender, right? They have a right to a room assignment that aligns with their gender identity. Also a right to be called by their chosen name and pronoun. Different from patient safety when we're identifying them against their wristband, medications, tests, etc. And then also the right to use a restroom that matches their self-identified gender. So the gender diverse experience, and I kind of just, mentioned this briefly before. So there's a difference between gender affirming healthcare and gender diverse people in healthcare, right? They're two very different things. So gender diverse healthcare, that's the journey to gender affirmation. That's saying, okay, I'm not quite where I feel I should be, and I need to get myself there. What steps can I take? It includes non-surgical steps, it includes surgical steps. Then you have gender diverse people in healthcare, which means they're individuals just like the rest of us, right? Just because you come into the hospital and you identify as a trans individual or gender diverse individual doesn't mean you're automatically like, oh, okay, I'm pretty sure they do that up on Nine-Monty. That's a Nine-Monty bed, it's a Nine-Monty patient, right? They might be coming in for an orthopedic procedure. They might be coming in for a cardiac cath. They might be coming in for, pre-surgical testing, whatever it might be. They still have a right to receive the healthcare that's appropriate for them. It doesn't necessarily mean that that's automatically gender affirming care, right? So you have to consider too that a lot of these patients, a lot of these, people in this population, they have social determinants of health, like Andrew was going through, that might put them at a greater disadvantage, and we need to be aware of that too. So as he mentioned, right, why is this important? We have to strive to create an environment that supports diversity and inclusion across the board. Every patient deserves the right to have a respectful experience. They have to have dignity, and they have to have a voice. We need to include their voice in their care. And when we're taking care of people, it's really important to remember, and I love this image and just this idea, the golden rule versus the platinum rule. And I'm sure a lot of people have grown up hearing the golden rule, right? Which is treat people how you want to be treated, right? You have to treat somebody else how you want to be treated. But we have to take that a step further, right? It's not, how many of us learn in nursing school that we have to put our own biases, our own values, our own, predispositions aside because it's not about us. We're taking care of somebody else. We're assigned to take care of them and be their advocate and support them. So the platinum rule, which goes beyond that, is treating people how they would like to be treated, right? Not how I want to be treated, not how I identify, not what I think is right or appropriate, but what is that for them? And you get to know that by having conversations with your patient, being open, being honest, being open to learning new things, and having communication with them is the most important thing. So some gender terminology and going through, preferred name and pronouns, how do we introduce that with our patients? So I went through a little bit before. So we have the LGBTQIA+ acronym, and it's a lot of different things here, right? But we're going to be focusing more on that T, the transgender piece, right? So we're going to go through some terminology because not everything is exactly the same, and I'll have a visual for you in a couple of slides that makes it a little bit easier. So you have your sex, which is your sex assigned at birth, right? A lot of times this is male or female. It falls within the binary, right? And that's based on external anatomy. And then you have gender, right? Gender is a socially constructed role. And you think about it this way, right? How many of you have been to a gender reveal when it's like, oh, here's the blue cupcake, here's the pink cupcake, right? And there's nothing wrong with that. It's a societal construct that says girls are pink, boys are blue. Boys are trucks, girls are dolls, right? There's so many things that are involved with that you probably are not even thinking about that are just like automatic associations, right? So that is a societal construct of activities, attributes, what you wear, how you express yourself, right? The activities that you're involved in, the types of people you can associate with. Gender identity is internally. How does a person identify themselves to be, right? And this could match up with your sex assigned at birth, or it might not, right? Or it might be a fluid thing, right? Because I think a lot of us, we want to put things into boxes. We want to categorize things, and it doesn't always work like that. There's a lot of fluidity that comes there. So you have gender dysphoria, which is more or less the medical term, and that involves a conflict between what a person's physically assigned, sex might be versus their gender identity. And then you have transgender, which is a person who doesn't identify with their sex assigned at birth, right? And then you have cisgender, which I know sometimes people hear that term and they're like, what does that even mean, right? So cisgender is someone who identifies as the sex they were assigned at birth. Gender expression, right? Different than identity. I might identify as something. How I express myself is how I'm appearing to people on the outside. It's an external manifestation of my gender identity. And you can be gender nonconforming, gender neutral, gender fluid, where your expression is maybe outside of the cultural expectations of the binary, right? One or the other, male or female. And then all of that also is completely separate from sexual orientation. This is how someone identifies with their physical attraction to other people, right? It's also not something that's necessarily binary. You're not just gay or straight, right? You might be, bisexual, asexual, pansexual. All that has to do with how you view your sexual attraction and how it is with other people. So I love this image. This is called the genderbread person, right? Not the genderbread man, the genderbread person, right? And I think it's a great visual because it kind of shows you like right up here in your brain, this is your identity, right? Here, this is your attraction. This might be your sexual orientation. And then with your physical anatomy is defined by your sex. And all of that on the outside is your expression, how you're choosing to express yourself. And all of that does not have to be put in a box, right? This is different for every person. It looks different, it feels different, it is different for every individual. So as I was kind of saying, right, we go into preferred names and pronouns. Now, if you look at my badge, it says Annalise, right? But I guarantee you, if I'm being called Annalise, I'm in trouble, and it's my mother, okay? So most people will call me Annie, but I will say that sometimes if someone says, on my name badge, they say, oh, hi, Ann, nice to meet you. I have an internal is your middle name on your badge? It's Annalise. You're not going to call me Annie, at least call me by my full name, right? And it's a frustrating thing. And think about how simple that is, right? For me to just have that simple feeling, and think about someone who has a completely different preferred name for what they go by and the frustrations that they might experience if they're called something that's outside of that, right? So it's important to ask your patients, what's your preferred name? What are your pronouns? How would you like to be addressed? And also explaining to them too, like I just said, you have a responsibility as a healthcare provider to make sure that you are identifying them correctly for whatever it is that they have to do, if it's a medication, a test, a procedure, right? So you have to match their name and their birthday against their white wristband. But we've also introduced throughout the hospital these green wristbands where patients can write down their own preferred name on it. We have them on NIMONTI. They're available throughout the whole building. If it's something that's useful to you and you think you want, please let us know. We'll be happy to facilitate that for you. But it's a way for us to say, okay, maybe your preferred name is different than what's on that white wristband, and having communication with your patient to say, I'm going to call you with what's on your green wristband. but we have to use white wristband, right? So just understand the difference. These are some examples of preferred pronouns. Understand too, it's not going to just be binary. It's not just going to be, you know, she, her, hers, or he, him, his, right? There's a wide variety in between, and it's important to just know and understand what your patient might prefer. When you're communicating pronouns with your patients, because again, it's hard. People might be like, okay, great, you told me all the information. How do I use this with my patient? Normalize sharing pronouns and do it with your introduction. Say, hi, I know it says on my, my name badge, Annalise, but you can call me Annie. My pronouns are her, hers. How can I help you today? What's your preferred name? What are your pronouns, right? Feeling comfortable enough to introduce that with a patient. And knowing too that it's not going to, we're working on trying to make this a widely accepted thing. If you go to an 85-year-old gentleman and you say, hi, how are you today? Can you tell me your preferred pronoun? He might look at you and say, I don't know what you're talking about. And that's okay, right? But you're still doing the work. You're still going through the steps. You're still asking. We have plenty of patients that say, it's not Mr. Smith, it's Dr. Smith. Okay, well, my name is Nurse Rohrecker. It's nice to meet you. How can I help you today, right? So, and that's okay. That is a part of his identity. That's how he's identifying himself. Being a doctor is very important to him, and it's important that it's included in his name. So as frustrating as that might sound, that's a part of his identity. And any aspect or any name or anything that someone might want to be called could be an integral part of their identity as well. So it's important to include that. Using inclusive language, like I said, communication is key. If you make a mistake, the best thing you can do is apologize and just move on. You don't have to harp on it, but you do have to acknowledge that it happened, right? And I will tell you, when we had our first surgical affirming case, we had our first vaginoplasty come to the floor, I was assigned that patient. I was so excited. I was like, I am not going to mess this up. And the first time I used a pronoun, I used the wrong one. And I learned really quick that it's embarrassing and it's uncomfortable. But I apologized immediately, right? And the patient was so accepting of my apology and understanding, but also appreciated that I wanted to learn and I wanted to do better. And she was so great about the whole thing. Using gender neutral language if you're unsure, right? And just knowing too that it's important to empower your patients to have them have that conversation with you and listen and be kind. I know there's a lot of swag back on the table, even just something as a sticker, a pin, a badge reel, a little, pin with a flag on it. Anything that shows that you're open and you're inclusive is going to help. This is just some more inclusive language, right? Instead of saying sir or ma'am, you might want to address them by their name. Instead of father or mother, using something like parent or guardian. Husband and wife, you might want to say partner or spouse. Things like that, might kind of turn it from being more binary to less binary. How does it all come back to the culture? Everything comes back to the culture of care, right? Employees are going to be very familiar with this, but when we're dealing with our patients, connectedness, awareness, respect, empathy, these are all really important pillars when we're taking care of people, right? And how do we infuse that in this situation? Connectedness, taking the time to engage, ask them those questions, communicate with them, being aware, passing information on to your coworkers so they know as well. Using respect, right? And like I mentioned, if you make a mistake, you apologize and you move on. And having empathy, thinking about what must it be like on the other end. If I'm this upset that somebody called me half of my full name, how upset might somebody else be if they're experiencing something far worse? So last is a acronym to use. It's a communication tool from Team Steps about apologizing and service recovery and listening. So make sure when there's a mistake made, you listen, you apologize, you try to solve the problem, and you thank them for the opportunity that they gave you to make it right, right? Our manager always says, like, I don't know if something's wrong if nobody tells me, but when you don't tell me, you're not giving me the opportunity to make it right. So if my patient is upset with me because I misgendered them or, used the wrong pronoun or name or something, I want the opportunity to fix it. I want to make it better. And I want to make sure that the communication is open enough where they can say it to me and feel like they're going to get the appropriate response from me. And lastly, being an ally and an advocate for your patients at any step of the way is important. It's in pillar of nursing, but especially for this population, being kind, being prepared, being informed, and being confident in your communication. And, it's, as Andrew said, and, an iLearn is going out sometime this week for everybody in the building to complete. And it's in regards to cultural sensitivity and how to have these conversations and manage these patients in an appropriate way. But, building confidence is what we want. We want more and more people to feel confident in these interactions. And I'm going to turn it over to Karen to discuss gender diverse individuals with affirming care.
All right. So I'm going to talk really quickly about what we do here at Northwell Health. So in 2016, the Center for Transgender Care at Northwell Health was started to be developed. By 2018, it became the actual center, and by 2020, it was a physical location. It's one of the most important resources for our transgender community out in Long Island. As with all different areas of healthcare, we have Transgender Health has their own specific professional association that has guidelines that help with our clinical guidance for how we take care of these patients. They help with the criteria for the transgender surgeries, and I'll go over briefly about the ones that we perform here, the gender affirming surgeries, and just safe and effective pathways to care for and maximize overall health, psychological well-being, and self-fulfillment. All right. Annie touched on this before. One of the most important things for caring for our transgender population is that we have to take into consideration that everyone's journey is a little bit different. Not everybody's journey requires surgery. There are a lot of non-surgical interventions, hormone therapy. I know they talked about this in the video with an endocrinologist, counseling, how you're expressing your gender. With surgical, there are other things other than what we commonly refer to as the bottom surgeries, where you can have the facial feminization, the laryngeal shaving, body sculpting, breast augmentation. This is all for patients who are assigned male at birth. Okay, sorry. And then we do have the surgeries, the bottom surgeries for those patients, which is the vaginoplasty, which I'll quickly go over. And for the surgical interventions for the patients who are assigned female at birth, chest masculization, hysterectomy, vaginectomy, bilateral salpingectomy, metoidioplasty, phalloplasty, and scrotoplasty. So at Northwell Health, or at North Shore, we are actually the only place where you can have gender affirming surgery at this time on Long Island. So with this is our kind of our timeline for the surgical gender affirming care. So in 2018, they developed the vaginoplasty program. In 2019, we were excited on Nine Monty to get our very first vaginoplasty. In 2021, they started to develop the phalloplasty and metoidioplasty program. And in 2022, they performed the first phalloplasty and metoidioplasty. So it's really important with these surgeries that it's a very multidisciplinary care team. So you have not only the Center for Transgender Care, you have all of the surgeons, you have urologists, you have your primary care doctor, the endocrinologists that are dealing with the hormones, OBGYN, because for fertility option planning, because if you're transitioning, you want to have that in place. And it was just added in 2020 to the transgender health care.
Yeah, for WPATH.
For WPATH, for the optimization of care. Right. And so post-operatively, you're going to have a lot more of the psychosocial, just making sure that as you're transitioning, it's not just a physical transition, it is also a mental transition as well, and nursing is important both pre and post-operatively. So in terms of cases to date for North Shore University Hospital, this is just a pie chart that kind of represents all the different types of surgery. They're done at the main hospital, they're done here, and they're done at AmSurg. So as of right now, only 10% are the phalloplasty, metoidioplasty, and vaginoplasty, but hopefully that will continue to grow as our program expands. So what are the different types of surgeries that we do here? We do a vaginoplasty, which is a single surgical procedure in which a vaginal canal and labia are created and their urethra is rerouted. So the goals for this surgery to affirm the gender identity, to have a natural appearing functional vagina, to have an appropriate urine stream and a functional urethra, and the eventual ability to have penetrative intercourse and maintain sensation for orgasm. So all of these, again, are very just important in terms of just feeling like you are in the correct body. Our phalloplasty, very similar goals. So it's The phalloplasty versus the metoidioplasty is a little bit more complex. It's a 3-step process where you have the creation of the neophallus, the urethral lengthening and vaginectomy, and then the optional of erectile implant or prosthesis, scrotal prosthesis. It's as I mentioned, it's a little bit more invasive and takes a bit more time than the metoidioplasty as well. So the goals for this, again, affirmation of that gender identity. You're having the male appearing and functioning genitalia, a creation of a phallus, 4 to 7 inches, scrotoplasty, which is a possibility, so the creation of the scrotum and testicular implants, the option of voiding, standing up, and with urethral lengthening, which is very important for this population, to maintain sensation for sexual arousal and the capability of penetrative sexual intercourse with erectile implant and prosthesis. And then on the other hand, you have the metoidioplasty, which is less invasive than our phalloplasty, and it's accomplished all in one go. You do also have the option of the scrotoplasty after, but it's a little bit more simple. So again, the goals with this, affirmation of gender identity. You create a small neophallus using the hormonally enlarged clitoris. The neophallus is a smaller, which means there's a little bit less option for limited capacity for penetrative sexual intercourse with the phallus, but the urethral stream is also very important. Being able to pee standing up, and then you have the maintenance of sensation and the natural erectile function, which comes from the testosterone replacement and the releasing of the ligaments, the suspensory ligaments on the clitoris, which has created the neophallus. So, sorry, very quick overview of what we do here, but it's been a great learning experience, and it's pretty fantastic when you get to see these patients who are finally able to visually express what they identify as. And just to touch on for patient privacy. So we have these signs that go up on the doors because you really just want to take into consideration the amount of respect that you have to have. Sometimes after these procedures, you have to be in really compromising positions. With the phalloplasties, I mean, the neophallus is held up, has to be upright continuously. And with metoidioplasty, sometimes it's a lot more comfortable to have your legs splayed open. So if you're having people from all different parts of the hospital, you have your EVS, your dietary transport, physical therapy coming in, you want to have the respect to know, you're approaching a situation where someone may be in a compromising position, and you want to be aware of that and be understanding that you have to be a little more considerate of how they may feel, and just to give an overall idea before you enter a room that just be more respectful. And that is it for me.
Okay. So the only small, before I move on, clarification I'll make that Karen described our program so beautifully is that we're the only hospital on Long Island right now that performs those 3 specific procedures, which are affirmation procedures. But I mean, there's plenty of hospitals all over the island and the state that perform other types of affirmation procedures, whether it be breast augmentation, mastectomy, orchiectomies, things like that. But we are the only hospital on Long Island that provides those 3 specific procedures. So as far as perinatal care, right, because this is something that is, as we talk about, how WPATH has included reproductive health and reproductive care, it's something that's important, right? Especially when we talk about these youth, right? They're going to be coming up, and there's family planning involved with that. A lot of the considerations for this population, anyone who is gender diverse that is going through, anything reproductive or family planning, is, acknowledging, as we mentioned, names and pronouns, and also understanding that physically there might not be a lot of changes to their care or the pathway of their clinical care, but understanding too that terms, gender terminology is very gendered, right? fetal maternal medicine, mother baby, right? Breastfeeding, all of these things that, you know, they aren't necessarily very gender inclusive. So some people might prefer the term chest feeding to breastfeeding, right? Or, you know, a postpartum recovery as opposed to, you know, mother baby or something like that. So those things to just keep in mind here. And Rebecca, one of our nurse educators, does this presentation, has a whole beautiful presentation that she does every single month with those labor and delivery fellows. So in conclusion, right, what's important? We want to promote an environment that supports diversity and inclusion, allows our patients, our colleagues, and communities that we serve to be treated with dignity and respect. And we have to be committed to the delivery of culturally competent, safe, right, and patient-centered care while we work to make sure everybody feels included. So what can we do, right? And we've kind of talked about all this, but you can do all the things that we mentioned, right? You can be open, you can be honest, you can all those 6 Bs that we just reviewed. The best thing to do is if you don't know, to ask, right? NIMONTE is here as a support. I would consider us experts in this category. So if you're working and you ever need help or resources or questions, please feel free to reach out to us, to Nursing Education. And I know that Andrew is going to post some of those resources in the chat. Thank you very much for allowing us to present to you today. Does anybody have any questions for us? Yes, Brady. Yes, I'm glad you brought that up, and it didn't make it into our presentation. So teletracking right now is a little bit of a hit and miss because it really depends on how that patient goes into the system on a legal basis, right? And it's something that obviously you deal with from a leadership standpoint. We might run into some issues. I will say that they have introduced into the header in Sunrise, if you've seen, preferred names and pronouns there, and it's in green, which is very helpful. Teletracking is a good point, and I think something that we can continue to work on to make sure that it's accurately reflecting maybe the patient's identity versus, you know, what their sex is assigned at birth, right? Because it's inappropriate to be asking people like, oh, let me lift up your gown so I can figure out what room you're supposed to go to, which is something completely opposite of what we want to do. So thank you for bringing it up, and I'll definitely talk to Maud or Denise about it and see how we can improve that to make it a little bit more streamlined. Anybody else? Well, if you do have questions and you're too shy to ask now, then that's completely fine. You can reach out to us and let us know. I hope you enjoyed the pizza and the rainbow cookies. And thank you guys so much for coming and listening. It means a lot to us that we could share this with you. So thank you.